Hello, everyone. My name is Dr. Joseph Hammer, and I'm an assistant professor of counseling psychology here in the College of Education in the Department of Educational School and Counseling Psych. My topic is not so dissimilar from what Dr. Gusky talked about. It's also about tests, but tests writ large. We use tests all the time to make extremely important decisions in life. Will your student get selected for a talented and gifted program in school? Will a family member get disability accommodations that they really need? Will a prisoner who is up for parole get released because they scored low on a risk factors assessment? When we use invalid or bad tests, we make invalid decisions that can really hurt the people we love. So it's really important to use accurate tests. In addition to studying what stops people from seeking health care when they need it, my research lab studies tests and how well they measure what they're supposed to measure. For example, one test I recently looked at tries to measure how much stigma, how much prejudice, how much judgment, negative judgment, a person with mental illness like depression or anxiety feels. Okay? And so a person completes this 29-question test, and there are 6 scores that are created by this test. And we interpret each of these scores as meaning something important about how they experience their mental illness and the stigma they feel around it. The first score is an overall stigma score. It represents a total score for the entire 29 items, and that's thought to measure a person's overall level of felt stigma. It also has 5 specific scores in these 5 areas you see here. So for example, how much this person is socially withdrawn because of their mental illness, or how much they endorse negative stereotypes about people with mental illness. So this instrument, this test, and these 6 scores are used by researchers and clinicians across the globe to learn important things about mental illness and healthcare and to help treat patients, such as in our VA system here in the United States. So it's very important a test like this measures what it's supposed to measure. But I took a closer look at this test, and I started to see some things with these 5 specific scores that I became a little uncertain about. And so, like any good scientist, I went and collected some data. I collected 758 surveys from depressed adults in the United States. Each of them completed this 29-item test. And then I used statistical methods to figure out how well are these scores measuring what they're supposed to measure. And you can probably guess from the title of my talk what I found. I found that these 5 specific scores actually just remeasured the overall stigma factor, not the specific things we thought they were measuring, which is obviously problematic because researchers and clinicians took each of these 5 scores and made meaning of them. They thought they were measuring something important, and they made policy and clinical decisions that impacted the patient's lives. But actually, they're just measuring the same thing that the overall total score is. That's problematic. It's extremely misleading. And this study, among others that I've done on other tests that we use, really drove home for me the importance of being skeptical about tests. Tests are developed by humans. We're not always great at developing good tests. So the next time you or your loved one takes an important test, ask yourself, is this test score telling me the truth? Is it measuring what it's supposed to be measuring? Researchers like myself are very invested in asking that question. I'm very passionate about testing the tests to make sure they measure what they're supposed to measure, and we can trust them when we're making decisions that impact the lives of the people we love. Thanks.